Choking is a common thing that you may have to deal with. People choke for different reasons, but mostly with adults it'll be food. With hindsight, choking is preventable, as you could have cut food into smaller pieces and not eaten as much or eaten while talking. But often it can happen where someone could eat something and it gets stuck in their throat. Let's look at a definition to start with. Mild choking is where there is an object in the throat, but air can still pass. The patient will be able to cough, breathe, and maybe talk. A severe airway obstruction is where the patient cannot cough, breathe, or talk. If someone is choking, they may try and leave the room as they're embarrassed. Stop them and try and help. When you approach somebody who is choking, the first thing you need to do is say, "Are you choking?" This is a good thing to say because it's forcing them to try and answer the question and you gain consent. If they just nod, then it's highly likely they are choking, or they may show the universal sign of choking, which is putting their hands to their neck. This is a sign that someone has a severe obstruction. If they can talk, then it's a mild obstruction and you can allow them to cough. If they were choking, we would deliver 5 back slaps and 5 abdominal thrusts and repeat this until the obstruction is removed. Place one arm around their waist just to support them. With the heel of your other hand, give them 5 distinct back blows between the neck and the shoulder blades. After each slap, check to see if the item has been removed. The idea of these blows is it will hopefully dislodge the item. If this does not work, then we would do what's called abdominal thrusts. You may well know of abdominal thrusts by an older name, the Heimlich maneuver. Place your arms around the waist, turning the thumb side of one hand just above their belly button and the other hand over the first hand. Deliver 5 abdominal thrusts in an inward and upward motion, checking after each thrust to see if the obstruction has come out. If this does not clear the obstruction after 5 attempts, deliver 5 back slaps again, 5 abdominal thrusts until the obstruction has been removed. If the patient becomes unresponsive, start CPR at the chest compression stage and make sure the EMS have been called. Even if you clear the obstruction, the patient should still seek medical evaluation, as you may have caused internal injuries when delivering the thrusts. For this reason, it's a good idea if there's someone else there to call the EMS as soon as you realise there's a problem.